Ladies and gentlemen, we will begin our broadcast in 30 seconds.
My fellow Pennsylvanians, good evening and thank you for joining me. I want to talk with you about where we are with this pandemic and where we hope to be. Each day, we face a new set of realities and a new set of fears. But we Pennsylvanians are facing these new realities with a calm determination that has been nothing short of extraordinary. We're doing this together even as we live apart. And I want to thank every one of you for facing this crisis in such courageous and masterful ways. We really are an amazing commonwealth peopled by amazing citizens. In the end, I believe we will get through this because of the kind of people we are. But I understand that even the most courageous and determined people need to have some sense of where we're headed. So in the next few minutes, I'm going to do my best to lay out a broad outline of what lies ahead for us. The process of dealing with this COVID-19 crisis and getting through it has, as I see it, 3 stages. The first stage, the one we're in now, is focused simply on buying time to allow our healthcare system to build the capacity we all need it to have. We cannot afford to allow it to become overwhelmed. We cannot allow this deadly disease to continue to claim more victims at an increasing rate. We need this stage to be over with as quickly as possible. The second stage will be a transitional one as well. It will take us from where we are now to the new normal that we'll face down the road. And finally, the third stage is that new normal. Let me outline each of these, giving you my best guesses as to what it will take to get us through it. Let me start with phase 1, where we are now. Again, the goal in this first phase is to do the best we can with the scarce resources we have to keep our healthcare system from being overwhelmed. It's a strategy that has been aimed at keeping us safe, but it has involved a whole host of painful sacrifices. Families have not been able to gather for the holiest of celebrations because we need to shelter in place. Children have not been able to go to school because we've closed them. Businesses have had to close to keep employees and customers safe. And all of us have had to distance ourselves in so many ways from the world we want to embrace, chief among them our families and our friends. So far, this strategy is working. We are making real progress, as you can see from Dr. Levine's daily updates, in bending the curve and diminishing the surge. People are still dying. The economy is still tanking. And we know that the draconian steps we are now taking cannot go on forever. The question, though, is how do we get through this phase as quickly and successfully as possible? The answer is still far from perfectly clear. But we do know that getting to the next phase will come down to at least 2 things. First, we will need to satisfy ourselves that the likely march of this disease will not outstrip our ability to treat people with the virus. So we are doing everything we can to keep each of us from infecting the people around us. And we need to continue to see real progress in this area. We want to see a drop in the number of new cases. We want to see sustained increases in the materials healthcare workers need to fight diseases like this. We need to see more personal protective equipment, including masks, face shields, gloves, and gowns. We need more ventilators, more beds. We don't have a hard and fast metric for exactly when we achieve victory, but we know we need to develop one, and we will, soon. Second, the transitional phase, when we start to reopen our world, our economy, and our lives, will depend on more and better testing. We need tests that can tell us when we're sick. We need tests that can tell us when we're immune. Now, Dr. Fauci has told us that we're only a week or so away from a rollout of an effective antibody test that will be able to tell us if we've developed an immunity to the COVID-19 virus. And that immunity will allow our frontline healthcare workers and our first responders to do their work unencumbered by the fear of infection. And to the extent that we satisfy ourselves that we can safely go back to work, to school, or to places of worship, we can all begin the work of moving out of this painful phase. And the hope is that we can do it in a reasonable time frame. The real goal, of course, is to get to the point that we can fully resume our normal lives. This will require time, along with a recognition that the new normal will be very different from the old normal we had grown used to. We will need to build stockpiles of the things a healthcare system needs to face deadly infectious diseases. We will need time to develop effective treatments for these infectious diseases, maybe even a cure. We will need time to develop vaccines. And we will all need time to rebuild our lives and our communities in ways that conform to the new altered normal. In the meantime, we need to keep doing what we're doing to restrain this deadly virus. And this includes the need to rebuild our sense of hope. We cannot afford to become complacent, but we need to recognize the fact that we will get through this, and therein lies our hope. The good public servants in the Commonwealth will keep doing everything they can to get us through this. The heroic healthcare and emergency service workers in each of our hospitals and in each of our communities will keep doing what they can to get us through this. And each of us will keep doing what we have been doing to get us all through this. Now, I recognize that what is being asked of each of us is very hard. Before this awful disease attacked us, we could be who we were. We were defined by our jobs, by our friends, our neighbors, and our families, and our pastimes. Now we must isolate ourselves. We must stop doing what we were doing, or making, or how we were interacting. And we could be forgiven for wondering if it's all worth it. Well, again, by the numbers we've all seen, the reduction in the rate of increase of new cases, the flattening of the curve, we are defining ourselves in a new and better way. By doing nothing, by distancing ourselves from others, by staying home, we are making a difference. We're saving lives. We're saving our children, our neighbors, and our friends. By doing nothing, we are doing something truly extraordinary. And for that, I thank you.